So South Africans are relieved to learn that the country has finally exited the devastating third wave of COVID-19 infections, as confirmed by the NICD on Monday. In the last 24-hour reporting cycle, 1,376 new cases were identified, representing a test positivity rate of 8.6%. 201 more people succumbing to the virus over that period, bringing the total number of fatalities now to the pandemic to 87,417. So the question we're all asking now is, how soon should we expect a family meeting? Dr. Michelle Groome is the head of public health surveillance and response at the NICD. She joins us now via our video link. Dr. Groome, it's great to speak to you this morning on the AM report. You know, one worrying thing that, when we saw the update overnight from the NICD, in terms of new cases, 1,367, that's almost double the previous day's report. Is this something that concerns you?
So I think we've seen all through the pandemic that, that there's day-to-day variability in terms of the number of cases that we report. And usually, cases that are being reported on the Monday or Sunday and Monday are usually lower because they're reflecting cases over the weekend. And we had the long weekend as well. So I think people didn't test, and then, obviously with the new week they would then test, and so we see the numbers going up slightly. So I think this is the pattern, and that's why we generally, look more at that 7-day moving average.
Right.
Because that kind of evens out that day-to-day variability. And definitely we've been seeing decreases in that 7-day moving average of new cases. And
the same goes for the test positivity rate. That's another number that we've been keeping a close eye on, because at the height of the third wave of the pandemic, it was as high as 30%. We were hoping it would get down to 5%. The WHO saying that's where we can talk about opening up our economy. So it went again, as you say, over the weekend to 3.8%, and then the overnight update now at 8.6%.
Yeah. So I think once again, the trend is moving downwards. And in the last couple of weeks, there's been this persistent decrease in the percent positivity, as you rightly so, from mid-30s and some of the provinces almost hitting 40% there. So definitely it's been on the downward trend. And so we put out our weekly report, which takes from, Saturday to Saturday. And definitely, last week was much lower than the previous week. So we'd expect that would keep coming down.
Yeah. So the daily updates that we're getting is not a true reflection of, as you say, that 7-day moving average.
Yeah. So I think it's much better to look at that 7-day moving average.
Have we now gotten to the point where we are looking, and where the NICD is perhaps also throwing its weight behind lowering our lockdown level? There are even calls for us to move entirely out of a national state of disaster.
Yeah, so I think we definitely are discussing our position on that, and we do feel that, that definitely for now we could ease up on the restrictions, and that I think we really need to start kind of looking forward. COVID's not going anywhere, and so we need to really start kind of, seeing how we're going to integrate this into our health services and how we're really going to move forward, knowing that, we will still be seeing infections, but as we increase the vaccination rate, we're not going to be seeing that degree of hospitalizations and deaths that we were seeing, prior to the vaccine. So would really, be moving towards monitoring hospitalizations and deaths, maybe less so than case numbers.
Yeah. Vaccinations, that's really the key. I mean, you'll tell me. Is that the key when we start talking about opening up our economy even further, as you say, looking forward, looking towards living with the virus as opposed to living with all of these restrictions? The last update that I saw was just over 19% of people in South Africa fully vaccinated. Are we where we were hoping to be at this point?
Yeah, look, I think it's now just over 20%, and obviously that is, a fifth of the adult population, so it's good. It's not, I think, where we wanted to be initially, and there's been many hurdles along the way, but at least now the vaccine supply is sorted out, so we really need to, especially now during this time when the case numbers are down, to start vaccinating. And I think that really is the quickest way to get us back. There was always the talk of just, waiting for everyone to be infected and to get natural immunity. But I think that will take very, very long. And so the quickest way for us to get back to relative normality is through vaccination, because you're able to give a lot of people immunity. And so we really would need to push the vaccination to be able to do that. And we've seen this happening, for example, in the UK, where they vaccinated a large proportion of their population and were able to kind of really open up and lessen those restrictions.
And an important point about the UK, Dr. Groome, is even though a large portion of their population had been vaccinated, they still saw quite high infections under the third wave. But it's a difference between high infection numbers versus people landing up in hospital and dying.
Yeah, and I think that's what people really do, need to realize, is that it's possible to get an infection after vaccination, and we're expecting there to be, resurgences in the future. But we're, with vaccination, we really want to prevent those the severe disease, which is the hospitalizations and death and the stress on our health systems. And so definitely we would be expecting at some point that we would see increases in infections, but without that tremendous impact on hospitalizations.
Yeah. So December is coming. No doubt we're all hoping for a very different Christmas this time around, but we still need to get through election season. There's campaign season, which is now in full swing. We're seeing a lot of people gathering, not always gathering safely. Is that one of the stumbling blocks, so to speak, as we build up to the fourth wave, as we sort of prepare for the fourth wave?
Yeah, I think it's too early for us to be able to totally give up on all the mask wearing, hand hygiene, social distancing, and definitely, we know that the large gatherings are potential super spreader events. And so I think really what we need to do, and it's everyone's kind of role in terms of trying to move us towards, not having to be waiting for the next wave all the time. And really that is in terms of vaccination. And there's a lot of misinformation out there. There's a lot of, people are worried about many things. And I really would just encourage everyone just to look for the correct information and really, vaccination has proven to be able to control many, many diseases in the past, and this is no different.
For the NICD, what would an ideal fourth wave look like for us in the country?
Well, I don't know if there's an ideal fourth wave, but yeah. So I think it would be where, in the absence of a new variant, which we haven't seen, one that's concerning us at the moment. So in the absence of a new variant, we would expect, lower case numbers than we saw in the third wave. And really, we would expect a wave where there may be increases in infections, but that we wouldn't be seeing these increase in hospitalizations and deaths. Yeah. And so we are obviously monitoring in terms of watching the variants. And at the moment, Delta is still prominent. And I think some preliminary data is really showing we had that the C12 variant that we are monitoring, and the proportion of that variant is making up has actually been decreasing. And some of our early results show that if you were infected in wave 2 or 3 with Beta or Delta, that you should be protected against that particular variant. So I think there is some positive news that through vaccination and through, natural infection, a large population of South Africa has in fact been infected, that, we would be going into the next resurgence, better off than before.
Yeah, absolutely. That certainly is the hope. Dr. Michelle Groome, thanks as always for your time here on the AM Report. She is the NIC's Head of Public Health Surveillance and Response. Thanks very much indeed.